I am Brian Townsend from Only 2MG, and this is the Inside the Crisis podcast. So let's get right down to it. Our next guest is Chuck Marting from Colorado. I was on a actually, we're both on podcasts with Kevin Thompson, the Million
Yeah.
Dollar Podcast. And Kevin introduced us and we hit it off and we're trying to find ways to bring Chuck to some conferences and have him speak. And delighted to have him as a guest. So, Chuck, can tell us about yourself and background and what you're doing now.
Well, thank you. It's an honor to be here with you and to be able to speak with you and your audience today. Um, like you said, my name is Chuck Marting. I'm a retired law enforcement officer of just shy of 20 years. And I'll explain that here in just a second. But during that time, I was a DUI instructor and also a drug recognition expert. So I was able to go and testify in court on the signs and symptoms of impairment. Officers would pull somebody over, and if they found that it wasn't alcohol, then I was the guy they called out to come and look at them to do an evaluation to see, one, if they were impaired, but number two, to see what they were impaired with. And then we would go ahead and validate that, what my observations were through drug testing, either a blood test or a urine test. And then with that led to my being in the schools, which was life changing for me as a police officer to be able to go in. It was a different aspect of law enforcement because it wasn't so punitive or final when you're dealing with kids. You end up having a lot of kids that were in there that were involved with drugs and even alcohol. And I was able to detect that, but also go through the process with the school and getting these kids help and then having them come back into the school, and then my relationship with them at that point of showing them, hey, you made a mistake, we've got it corrected, let's move on, let's go ahead and do this. So I was able to show more empathy and compassion than I was just as a regular street officer going from one call to the other. And so that really changed my perspective on things. But what ended up happening is I was working our DUI enforcement one night, and I had a guy that I arrested, and he was just getting really upset that he was going to miss his pre-employment drug test in the morning. And I said, well, why don't you just get a mobile service to come in and take care of you? And he goes, well, nobody does that. And so I was like, So I looked into it, and sure enough, there was nobody in our area that was doing it. And so I told my wife, I said, I told you when we got married, I would do this for 20 years, and I always wanted to start my own business, do something else. And so she got on board, and we both got certified, going through the process of doing all these things to be able to do drug and alcohol testing for employers. So it was a totally different world than what I was in. So she started doing it. We figured it'd take us about a year and a half to build the business up so then I could officially retire. No, that didn't happen. 4 days into it, or 4 months into it, I'm sorry. My wife calls me while I'm on patrol, and she goes, you're gonna have to leave a lot sooner than you thought. So I ended up retiring early, and then we started our own business. We own Colorado Mobile Drug Testing and Focus Compliance here in Colorado, and um, it has grown into a very good business for us, being able to help employers and other community members to be able to recognize and identify the signs of impairment in the workplace. So that's been the big thing. I just authored my book, Mastering the Impairment Code, that came out in June, and it reached Amazon bestseller. So I'm pretty happy about that. You had a guy that was a beat cop that wrote many reports, and you got to do one of the things that I had on my bucket list, and that was to be able to write a book and to be able to do it for this industry that sorely needs it, man. We have so many people that they just don't know. They don't know what impairment looks like. They don't know how to handle it or how to even communicate with somebody, and have those interviews with them so that they know how to talk to people. The big thing is teaching them, kind of like in law enforcement, if you try to lead with empathy and compassion, it's going to open doors, and you're going to be able to do the things that you're looking to do and have those answers given to you so you know what direction to go into.
That's great. I'm sorry. I'm actually writing notes now. I don't have any questions prepared, but now that you've
Mm.
wow, interesting. So your business now, uh, I'm a company. I have
Mhm.
employees that I drug test. And I'm going to simplify this. You send someone a tech or someone over, and they or you or yourself maybe, and you perform the drug testing.
Yeah, so we go out on site, or we even have our own offices, one here in Denver. So I'm about 5 minutes away from Denver International Airport. So we do some pilot testing and stuff like that with the airlines. And then we have our main office, which is in Northeast Colorado. So a lot of times we'll have somebody that calls us and they say, "Hey, I think I got a problem. I need you to come out here and test my whole crew." All right. So it could be anywhere from a couple people to we had an airline company that contacted us where their CEO was walking into the break room and found a baggie of meth laying on the ground. Called
Oof.
us and he goes, "I need to get this taken care of now." So I had to circle the wagons and get all my guys in here, and we ended up doing over 200 tests that day between all of us, and that was a really cool story. And I write about that in the book as well. But um, there's just so many different things that we're finding with employers right now, and even community members or even parents. I ran into that in the schools. What do we look like? What do we look at with impairment, especially right now, marijuana, you have the edibles, you have the drinks, you have the vapes and stuff like that. Well, we're used to smelling it. Well, not anymore. Okay. They can vape this stuff and there's absolutely no smell to it. In fact, I had a guy that was vaping. He was working out on the streets doing the flagging, and his supervisor had gone through one of my classes. He goes, "Chuck, there's something here. I'm seeing signs, but I just need verification." Go out there and I have the guy empty his pockets before we do his drug testing, and he pulls out a marijuana vape that he was vaping in front of this supervisor when he was calling me to come out. So he's getting high right in front of his boss. That's how arrogant people become. They feel entitled with this. And we're seeing so many employers and other community members that are being bullied by their employees or by staff where they feel entitled and say, "You know what, it's legal and there's nothing you can do about it." And that is absolutely not the case.
That brought up a whole nother issue, which I want to bring up in a minute. But real quick, you mentioned 200 plus testings. CEO finds meth. You got to give me. I'm going to read your
Yeah.
book. You got to give me
Well,
something here.
yeah. Well, the big part of that was, and this is one of the things we run into, Brian, is people sit there and say, "But if I test for marijuana, I'm going to lose everybody." Well, not everybody is smoking weed or doing marijuana. Okay, I don't. That's what they want you to think, because it goes into that bullying part of it where they're trying to manipulate you to just not even worry about it, right? So I had to go and sit down with this CEO, and this is what his concern was. And it's a valid concern, even though it wasn't marijuana that he found. He was worried, if I end up testing all these 200 employees, I'm going to lose half of my people. And I have grants, I've got deadlines, I got all these things. I need these guys. So I told him, I said, "Look, first off, not everybody's going to come back positive. But number two, just because they come back positive for marijuana, unless it's DOT, you don't have to fire them. You can choose to have a different course of action." And so people are saying, "Well, we can't pre-employment for it." You can, unless your state law says you can't. We have a few states that have that. But I tell people, what are you pretending not to know by not testing for it? If this person gets into an accident 2 days after you hired him and it's a fatality, who do you think they're going to come after? And then they're going to say, "Well, why didn't you drug test them?" And if you say, "Well, that's because everybody does it," well, you just ignored it, and now you're going to have to pay the price. When I talked to the CEO about that, it made a lot more sense to him, and he understood that now this is what we need to do. So he was the first one to be tested out of the 200 people. Okay. Out of the 200 people, how many do you think, Brian, we came up with that were testing presumptive positive for drugs?
Without knowing any more facts, no. But however, knowing that you live in a state that has not only legalized but encouraged the use of marijuana,
Yep.
I'm gonna guess. I don't know. I'm gonna be conservative. Let's say 10% tested positive for marijuana.
We had less than 1%.
Awesome.
We had
Great.
four people, two for methamphetamine. So we found who dropped the meth, and then two people for marijuana. Okay. This was an incredible experience for this CEO, and it was life altering for him. But what a relief. This guy was able to go home that night and sleep, knowing that he didn't have a serious problem. And that's the big thing. It is a serious problem. We do have it in the workplaces. People are high every day. We have people every day that do this. However, there are things that we can put in place, and I teach people zero tolerance is something that is final. It's a finality. It's disciplinary. It's after the fact. What I'm trying to teach people is what I call zero blind spots, recognizing the subtle signs and symptoms of impairment before it gets to that point of being a crisis or before we have something seriously happen. So I'm not telling you, smell of marijuana or bloodshot eyes, slurred speech. That's easy. And those things aren't always the prevalent sign. That's after the fact of impairment. But it's the subtle things of all of a sudden this employee's work performance is no longer where it's at. You have somebody that's worked for you for a while. They've never had any problems with their work, but now they can't finish the task. They can't remember how to do things. And you're having other team members that are having to pick up the slack and do things for employees. And so they're coming to you going, hey, what the heck's wrong with Jimmy over here? I'm having to finish his stuff too because he can't remember how to do it.
It's almost like a baseline. When we talk to parents, they always ask, what do we look for? And I said, we just look for changes. You know your son and daughter better than anyone. What's going on with their grades? What's going on with their friends? What's going on with their, extracurricular activities? Did they quit the sports team? Did they stop going to the chess club? So it sounds very similar where, you know your employees, like you said, what happened to his performance? Why is he missing these deadlines? Why is he, not showing up or showing up late? It sounds very similar there.
Well, and that's an excellent point because that's what I tell employers and supervisors when I do this training with them. As I say, look, you see your team members more than their own families do. You may have even had telephone calls from their family being concerned, saying, "Hey, what's going on with Dave? I don't know what's going on, but he's coming home. He's agitated. He's, whatever the things are that they're seeing." So they're asking you, "What's going on at work that he's coming home like this?" So you may see things way before anybody else. And believe me, it's not just marijuana. We're talking prescription drugs, we're talking alcohol, we're talking all these things where if we can find those subtle hints, just what I teach people is have a 30-second check-in with these guys every day. Talk to them for 30 seconds. You're going to know if you need to continue that conversation because either it's going to be nonsensical, they're not going to make sense with what they're saying to you, or you're going to be picking up on something that just kind of curiosity. You're going to be like going, man, that doesn't make sense. We need to go talk for a little bit more and figure this out.
I love this. This is leadership. And I've done a couple of leadership podcasts, and people are like, "Why are you doing leadership when you're talking drugs?" Because what you're talking about to me is building an environment that's part of the culture, right? You caring for your people, learning about your people, taking an interest in your people, building this caring environment. And like you said, this CEO goes home thinking, "Wow, I don't have a problem," and
Yeah.
it, what a wonderful thing, right? And just part of that culture that can be healthy and drug free.
Well, and the other thing is this though too, Brian, is that every single day we have people that are misdiagnosed thinking that they were high, but it was a medical condition.
Mm.
You have people that are diabetic, epileptic, or have other neurological disorders that if they're not taking their medications or whatever the case may be, they may appear to be impaired. There was just a case just a little bit ago with the United States Postal Service where they arrested somebody. They thought the person was under the influence, put him in a holding cell, and guess what? He was going into diabetic shock. Okay. So now you have that whole litigation that's going on. Now, am I telling you you're going to be able to catch it every time? No. But if you're looking for it and you're talking to people about things and not being dismissive and saying, oh, he's just having a bad day or whatever the case may be, well, find out why he's having a bad day. It may lead to you wanting to ask more questions and then resolving this. But I can give you a perfect example of this. I went out to go into a test with somebody and I went to go and test this guy and I tested him, but I came to the supervisor and I said, look, I'm not seeing any signs of impairment with this guy. I'm not seeing any drug influence. You might want to have another conversation with him and just find out what's going on personally if he'll talk to you about it. Well, they found out that this guy's daughter was getting married. He was stressed that he didn't have the money and the funds to take care of this. So he was screwing things up. Well, guess what? Every employer, or most every employer, has an EAP or an employee assistance program. They went to that employee assistance program, and guess what those guys did? They sat down with him and his wife. They helped plan his daughter's wedding.
Oh, wow.
So what happened with that guy when he came back to work?
Loyal.
He was relaxed. He was able to do it. But then you keyed on in that he is loyal to that company now because they showed him empathy, compassion, and they helped him.
Oh, wow.
He what better mouthpiece can you have for your company and your reputation than an employee going, "Hey, these guys are awesome. Look at what they did for me." That's what employers want. Employers, the last thing they want to do is have to fire somebody because they're high on drugs. So let's put all these preventative things in place to help it so it doesn't get to that point where we're reactionary. And now we got to fire somebody that you really didn't want to fire because let's face it, he was a good employee, but he's got an addiction or a problem with drugs right now.
I love that, being proactive, not reactive, or not just reactive.
Yeah.
So in addition to, peeing in a cup, it's and I'm just pimpling it down here.
Yeah.
It's impairment. It's so these are you doing trainings within these, or is it more of the
Yeah.
conversations you're having with the, C-suite, or a
Yeah.
little bit both?
That's a great question. We do reasonable suspicion training with supervisors. I mean, I think about this with people that you come into contact with, they're the safety manager. All right. A lot of times, what we have found is that somebody gets promoted to that because they were a great employee or whatever the case may be. They give them a book and they say, "You're in charge of the drug and alcohol program. God bless you." And that's the extent of their training. So then when I show up and I'm doing a drug test, these guys are looking at me like deer in the headlights going, "What do I do next?" So we go in there doing reasonable suspicion, especially for your non-DOT, the people that aren't regulated. They have absolutely no clue in most cases. What do I do with drugs? Can I fire somebody? Can I hire somebody? Can I keep this person? So we really like to address that part of it. But we also do it for DOT because it's mandatory that those supervisors go through it at least one time. We do a refresher course with them because there's other drugs that come into play, okay? We know right now that fentanyl is a huge problem, correct? Did you know that DOT and non-DOT, they do not test for fentanyl in their mandatory testing? And your drivers know that. They know that too. So a lot of them are using it because they can get away with it because it's not being tested for. So right now, HHS did come out, or Health and Human Services came out saying that they are going to start testing for it, but they have to go through this whole process to be able to get to that point, to be able to add it to the drug program. But right now, currently, we do not test for fentanyl with DOT.
Wow.
So that means your pilots, your truck drivers, those guys are not being tested for fentanyl.
Those are the things we'd like to see change. Now, you probably hear a fire alarm in the background, so if a fireman comes in and pulls me out, then that's
I'm
why.
glad it's on your end and not mine.
Yeah, I apologize. They're doing testing today,
You're all right.
but like I said, fireman does come in, then things got real here. But
We're good to go.
I'm curious, outside of DOT, I don't know if you have any percentages. How how common are your services for people who don't, quote unquote, need them? Legally speaking.
Well, there's a couple things. We have one of the largest grocery chains here in the state of Colorado that we do all their drug and alcohol testing for a reasonable suspicion and post accident. So they call us. It could be 10 o'clock at night, and we go out there and do that. Um, we have 12 hospitals in the Denver metro area and outside of the metro area that we do their drug and alcohol testing for their employees. Okay. So, how many times have you heard of nurses or doctors or even hospitals having missing narcotics or something was we go in there and do that testing for them. Okay. Those guys, a lot of times it's because somebody miscounted the drawer or it was put in a different place. So a
Mm,
lot of times it's not because of abuse,
sure.
but you still have to do that. Now there have been some cases that I was pretty shocked going in there and testing somebody to discover some of the things that was going on. But I can tell you right now, I would say, Brian, about 70% of our emergency after hours calls for service have been for alcohol. And I contributed a lot of that to COVID. We isolated people. You couldn't go anywhere. The only things you had that you could deal with anything, medications, alcohol, or marijuana. So now that we have people that have gone back into the workplaces, these individuals, even people that were getting treated for alcoholism couldn't go to their meetings. They had to be online. We had a lot of people relapse. Okay. They didn't have that support that they had before. So now it's bleeding over into the workplace and we're discovering it. I've had professionals, CEOs that have come up positive for alcohol. We've had them come up positive for marijuana. I caught a CEO that gave me synthetic urine trying to pass his drug test. And so I had to take him into the safety manager. Talk about a difficult conversation for that safety manager because now he's dealing with his boss who just gave me synthetic urine. And so his boss looked at me and goes, "Look, let me just go ahead and make this easy for you. My wife has a medical marijuana card. She smokes it. I smoke it once in a while with her as we're sitting out on the porch. I knew I could get drug tested. That's why I had it here. I tried to give it to you and you caught me."
Wow.
So as I'm cleaning up and getting ready to leave, they're escorting the CEO out of the building because now he is terminated. Okay. Now, am I saying it's that drastic in every workplace? No. But if you don't know what to look for, you're going to miss it. And so the other thing that we do, Brian, is we also teach employees signs and symptoms of impairment because they
Mm,
work with your guys just as well much. And they're the ones that are coming to you saying, "Hey, Jimmy over here is doing this, this, and this." Now, you as a supervisor, now you have something to go and talk to Jimmy about and see if you also see these signs of impairment. So then you can say, "Look, we need to do a drug and alcohol test with you." And so that has been really good because it also validates to your employees, why do you drug test? Why are we having to do this? And so when they see this and they get it and they get buy-in, I have some employers that call me back and said, "It was the greatest thing we ever did, but these guys are driving us nuts with everything that they're seeing now." So everybody's under the influence of drugs. So you have to kind of reel them back in, but they're
yeah.
excited because now they got some knowledge and they're trying to test it and see if they can figure things out. They're on your side. You're not the bad guy anymore. They understand. And when you do that, guess what your employees are going to do? "Hey, man, you need to come and work for these guys. They're looking out for us. You're going to be safe." It changes the whole dynamics in your workplace. It really
Yeah,
does.
you go back to the like, again, the environment, that psychologically safe environment, that culture that cares about people. It's yeah, you've come back around that quite a bit. It's interesting. You mentioned marijuana. Let's get the elephant in
The,
the
the
room
the big
here.
elephant in the room right now, huh?
Yesterday, December 18th, 2025, President Trump signed an executive order to expedite the rescheduling from Schedule 1 to Schedule 3. Thoughts?
Mm. Well, it's
You have
funny
enough
because
time?
I've been going crazy this morning with calls because there's a lot of people that are concerned, a lot of people that are confused. So look, let me just start off by saying that right now a presidential directive does not, in and of itself, change federal law. Okay, so under the Controlled Substance Act, marijuana is still a Schedule One drug right now. Um, until the Drug Enforcement Agency or the DEA comes out and they complete their formal rulemaking where they have to go through their processes to see, does this, with the information we have, give us the ability to reclassify it? So even before they get it, all right, Brian, they have to go through Health and Human Services and the FDA. Those two organizations have to provide evidence to the DEA for consideration. So studies, things that they're saying that marijuana does, why it needs to be rescheduled, because they're saying in Schedule 3 that it has some medical value. And that's what they're trying to do. If you watched what President Trump did yesterday, he's saying that by doing this, it opens up the ability for these organizations to be able to do the research and have the funding that they need to do that. Look, here's the deal. My fight is not with medical. Okay. If it works for you, then God bless you. I hope it does. But we have no studies right now that validate that it relieves pain. Okay. Now these guys would be able to do that. Okay. Great. Because now we're going to have an answer. Does it or does it not? Okay. But the part that they're not addressing, that where my phones are ringing off the hook and people calling me, and you probably heard some of the messages coming through my computer because I forgot to turn it off. People are going, "Well, what does this do to the workplace?" Well, let me tell you what it does to the workplace. if they should choose to go ahead and reschedule this and they don't have a safety carve out, and what I mean by that is saying safety sensitive people, pilots, truck drivers, train engineers, people like that, they still cannot use it because it's an impairing substance. Okay. If they don't have that there, we are no longer going to be testing pilots, truck drivers, or any of these guys, period. Even for reasonable suspicion or even a post accident, they're still not going to be tested for it. Okay. So that changes the whole dynamics of things. And so you can understand why people are really panicking right now. Here's the good news. All right. We have the ability to have our voices heard right now. Um, the president, like I said, he's directing the attorney general to initiate and expedite this review. But when DEA gets a hold of all this stuff, in most cases, what they're going to do is they're going to have a public comment and potential hearings on this for the reclassification for this. That's what's important. That's where everybody needs to get a hold of them and say, look, because they're going to have it open to the public. Why you do not want this to be legal in your workplace, how it's going to affect you, what it's going to do. Is you watched yesterday, one of the things when I watched that press conference, you had all these doctors that are there and they're giddy and they're excited because now they're going to be able to do their research. Did you see any employers there? Did you see anybody from an industry that would be affected by this, like the Truckers Association or any of those organizations? Did you see them there at that signing? Did they even address that issue part of it? No. So we're still trying to wait to see if that was included in this order that President Trump is signing or if he's asking for. Now they've kind of alluded to it in some of the things I've read, but we've not seen anything concrete on that. And so what that means for people in my industry and what we do is we're going to need to get our voices heard. I sent a letter out uh, to my clients, and I've got letters that are out here on our desk because people are going to come in and they're going to think they're going to do it. Look, my son who works for me showed me a video yesterday after this happened with President Trump of a truck driver lighting up a joint and driving down the road because he thinks he can do it now. Okay. This is the misconception that we're getting. People think that because he signed it, that it's automatically law now, and that is not the case. This could take, depending on what HHS already has and the FDA already has, it could take months or it could even take years, Brian, before this actually gets rescheduled. We don't know. But as of today, it is still a Schedule 1 drug. You can still drug test for it. People can still be disciplined or go through your process, whether you choose to keep them and get them the help that they need, like we were talking about, or you end up putting them into an EAP program where they can get the help that they need, overcome that substance abuse and use, and then come back to the workplace. But as of right now, employers don't need to go into panic mode yet. Okay. It's something that's concerning. You need to be able to get this stuff addressed and get to your Congress people and the appropriate channels to voice your concerns of what's going to happen if they choose not to have a safety carve out or they choose not to drug test for it. But we need to get that going. And that's what groups that I'm involved with and what I'm trying to do right now is to give that sense of urgency and get these guys to understand that, look, just because it's legal doesn't mean that it's safe. We know that marijuana is impairing. Part of this in the Schedule 3 is that they're saying that it's less addictive and less harmful, but they're not saying that it's less impairing. And that's the key point that we need to go on is that how is this going to affect our communities, our families? How is it going to affect our workplaces when this happens? Because I can tell you right now, if you don't test for it, and they don't allow us to test for it, and this person gets into an accident and God forbid it's a fatality, who do you think they're going to come after? They're going to go after the employer and they're going to go after that liability insurance
Deep
and they're going to
pockets.
pay it out. So that's why it's so concerning and it needs to be addressed.
Is there anyone from your perspective that would be opposed to a safety cutout? I mean, surely DOT and everyone else is going to want something like that, right? I mean, we want our truckers, our pilots test. I'm just curious from your perspective, are there people that would oppose this?
Yeah, it's amazing to me and I don't like talking negatively about people. Okay, so but I can tell you there are some organizations that are pro marijuana that are so happy about this that it opens up a lot of things for them. Okay, I was part of a discussion where when it said, look, we need to have that safety carve out because if a pilot were to come to work and get on a plane, there's nothing to prevent it. And so this person goes, well, that's not an issue. That's not a problem. We said, you're telling me that you would get on a plane with this individual, knowing that they've smoked weed because you can smell it or whatever the case may be, and fly with them. And she said, oh, yeah, not a problem. Because they don't believe that the impairment is something that is that obvious. Okay. The big problem that we have, Brian, is that people know the high that they're feeling is confused with the impairment that we're seeing. So when they get high and that high wears off, they think they're okay. They think they're all right. But you can see signs and symptoms of impairment for up to 72 hours after ingesting marijuana. So let me ask you, if you're doing it every single day, you're going to have a substantial amount in your system that is causing impairment without you even realizing it. It's kind of like an alcoholic. All right. We have functional alcoholics, we have functional drug users. Okay. Your body adapts to it. So they don't slur their words. They don't, they can drive, they can walk straight. They don't have balance problems. Okay. That's why I'm saying these subtle things that I'm talking to you about as an employer with that 30-second check in with people, having zero blind spots, looking at other things, work performance, how this person is reacting. Do you have somebody that all of a sudden has been really good about talking to you? You've never had any, now they're confrontational, argumentative, or they're getting angry. Just total changes from what you've seen before, things that you're going, man, what's going on with this guy? Those are the things that are going to help us if we know what to look for in identifying these issues in the workplace with people that do have an active addictive problem. Um, so we need to look at that and we need to not be blind to it and just figure it'll work itself out. Because if you're an employer and you have multi-million-dollar accounts and you're responsible for everyone in that workplace and their livelihood and everything else, you can't afford to have one person be on that line that could cause something to happen where somebody either gets hurt or, God forbid, somebody gets killed.
Yeah, very, very important. I'm glad we talked about this issue because so like you said, the perception is that, it's Schedule 3, everything's legal. We got truck drivers, like you said on my TikTok video, lighting it up, the
Yeah,
moment they hear that. And you look at a lot of the headlines, or I should say a lot of the social media posts. I mean, there's this perception now that this is it. And I'm sure that that's
party
probably a lot of the
time.
phone calls that you're getting.
Yep.
You get people have to slow down and actually read it and listen to it and have to understand that, excuse me, that this is going to, you know, take some time and it potentially could get changed, but potentially not. I mean, I guess time will, time will tell. Interesting.
Well, and that's one of the things that we have to look at. Right now isn't the time to sit back and not act. We need to find out, especially our employers or people that this is going to affect directly, even if it's family members. They need to hear how important it is that, yeah, go ahead and do the scientific research. I don't think there's not anybody I know, including myself, that are against you if you're saying medically, I'm going to use it for medical conditions. The problem is when you hear people say, well, you know what, it's safer than alcohol. And they think because it's safer than alcohol, they can get in a car and drive. Okay. It isn't. Even when I was a police officer, before we had medical marijuana or even recreational marijuana, I was arresting people for driving under the influence of marijuana. Okay. Or driving under the influence of drugs. And we find out it was marijuana. We know that it's impairing. We know that it causes issues. There's been studies that prove that. So this isn't just coming from the book of Chuck because I want to see this, outlawed. Okay. If there is a medical issue, then and a medical procedure that it can be used for, then great. We know that we have Epidiolex that's given to kids that have a certain seizure disorder. Okay, it's not because it cures it, Brian, but because through their studies they showed that it lessened the amount of seizures these kids had. So that's why they've done it. But in that same study, they found that it didn't have the same reaction with adults. Did absolutely nothing for them. But with kids, for some reason, it lessened it enough for them to go ahead and do it. But there's also disclaimers that are on that bottle of medicine that you're giving that kid where it says you're going to have irreversible liver and kidney damage from this. Okay. Now, I'm a parent, I'm a grandparent. If my kid is going through and having 800 to 1,000 seizures a day, and I have an opportunity to give him or her something that's going to lessen that, I'm going to do it, just like any parent would. We don't want people to suffer. So that's what I'm saying. If there are medical things that can be derived from this and we're able to show it, then let's do it. But it's for medical purposes at that point. It's not for me recreationally just doing this and going to work and then looking you at employer going, it's legal and there's not a damn thing you can do about it.
Yeah.
That's the difference.
Yeah, and that's the problem with marijuana is so divisive in that sense that it's all or nothing, right? And like you said, I mean, there might be some great instances where you're gonna use it or even violate the law, to help a family member. But the reality of it is, it is impairing, and it does cause problems, and but people just they can't separate that, right? They have to have all or nothing.
Well,
It's like
and
both things can't be
individuals,
right.
well, yeah, and individuals that use this and abuse it, they know this. We get between 5 to 8 synthetic urine specimens a day between our two offices, where people come in and intentionally give us something to cheat or adulterate their test, and we catch them. Okay. This is what we do. We know if you gave me real pee. All right. There are things that we look for. I've been teaching this for the last 10 years nationally because we had even hospitals I've gone and trained because you have pain management that you do with people, right? Well, what happens when you go see the doctor and they have you do your labs? Hey, you can go give us a pee sample now, or you can come back tomorrow whenever. Well, I had a hospital call me and say, Chuck, we need to do this training. I'm like, well, what's going on? They said, well, one of our pain management people came in and gave us a specimen. And when the technician went to go get it, it was so hot she couldn't hold the cup. And then when they go to find the temperature, it was at 180 degrees. And when they asked the guy, why is your pee so hot? He said, well, I drank coffee before I came in here. It doesn't work that way, my friend. But this is the things that people are doing. The 7-Eleven across from my office over here, I talk to those guys all the time. They put a sign on their microwave that says, "Please do not heat your urine up in our microwave," because people were doing that and then coming to see me trying to pass their test. Well, it would blow up because they would put too much in there, and then you have this synthetic urine rolling out the microwave. It even made the news here. Okay, this is what people will do. So if everything is okay with marijuana, if it isn't a problem, why are you going to that extent
Exactly.
to pass your drug test? Okay. Because people feel entitled. They don't like being told what to do, but they're trying to find a way around it. All right. And that's what we get. I've got boxes and boxes of synthetic urine. I went and talked to the Federal Transit Association, teaching them how to recognize and identify when people give this because it's such an issue. So when it gets to that point where the major thing that I'm talking about is people coming in with fake pee, all right, there's other things that we need to look at. Okay. And it's training, it's identifying this. That's why oral fluid testing for truck driving and pilots is great because it's all an observed test at that point. Open your mouth, we give you the swab, everything's done in front of us. Okay. There's very little opportunity for you to cheat on an oral fluid test or even a hair follicle test. The problem that people don't like with a hair follicle test is it's going to go back 90 days from the time that you do the test. Well, now you're looking at, does this person have a serious issue? So I have one employer, major employer, that they do both a hair test and a urine test. Because if the urine test comes back clean, but the hair test comes back positive, they know that you've had an issue for a lot long. So you've cleaned up for a couple weeks so you can pass your drug test, but in your hair is showing that you have a problem. So that's why they do it because of the liability that this company has. They're
This is
trying to
probably a
avoid that.
question you get a lot. What's the average length marijuana will stay in the system from the urine test?
That's a great question. So from first time use, from the last time you used, 5 to 7 days, it'll be in and out of your system. occasional use, so a couple days a week, whatever, anywhere from 5 to 20 days is what we've seen. If it's everyday use from the last time you use, it takes 30 to 45 days for it to get out of your system so you're able to pass a test. All right. Understand that we have no legal precedence as far as if you're at this level, you're impaired. A drug test is not an impairment test. It is only showing you the presence of it in your body. The impairment part comes from your observations and you calling me saying, "Hey, I have reasonable suspicion to believe that they're under the influence of this drug." So if you come in for a pre-employment test and it comes back positive, well, that just because it's positive doesn't mean that you're impaired. Okay. So that's the big thing employers need to understand is I get people that will get the test results back and it has the quantitative levels up in there and they're like, "Holy crap, we're testing at 50 and it's at 1200 for this guy. Does that mean he's impaired?" And my question back to them is, "Did you see impairment?" No. Well, then it's not impairment. And even the courts have done that with, it's public knowledge. Walmart had an issue where they had somebody that they fired that was a manager that was using medical marijuana down in Arizona where they're allowed to do that. They tested this person because they came up really high, the highest point that you can come at for being positive for that substance. They went ahead and fired him for being impaired and getting hurt at work, and went through the courts. And that's what the judge said. Did you see impairment? Well, no, but they topped out as high as you can go with this test. But did you see impairment? No. And it got dismissed, and Walmart had a huge lawsuit. Okay. So, but that's the same situation a lot of employers are because we get it confused with a positive drug test being an impairment test, and it's not. It's only showing you the presence of, and that's where your policies and procedures. Do you have, something in your policies that says that you cannot have any of this in your system because of what we do? Then that's what you're going by. It's not because they're impaired, it's because they're violating it, and they could be. All right. Perfect example. I have a teacher that I just did a test with that was in the workplace in an elementary school, and they thought, "Hey, this person was smoking weed during lunch." So they had me come over there, and the person's like, "Hey, I don't do this while I'm at work. I smoke it on my own time, but I don't do it here." Okay. Well, we don't have a test that's going to be able to differentiate home use and while you're at work. But in the schools, they had a school resource officer there. They had an administrator. I went to go do the test, came back presumptive positive for marijuana. We knew that, but he forgot to tell us about the cocaine that he had just the weekend before that came up on the test as well. We go back in the room and the police officer comes in and he throws down some gummies, throws down some candy, throws down some other things, and then a box of White Claw with two cans in it still. But he only does this at home. Okay. How many of those little kids could have walked by his desk and go, gummy bear? Okay, that's the issue, is that entitlement and thinking, "Hey, I'm responsible with this, so I'm okay." We don't know, and that's a problem. We can narrow down a window. Saliva tests are usually good for up to 48 to 72 hours with marijuana, showing use. Um, but we haven't got to the point like we have with alcohol, where you can come up with that impairment level. And in talking to scientists and everybody else, it's going to be a very long time, if at all, that we're going to be able to come up with that level.
Interesting.
Um, so keep that in mind when you're doing this stuff. Impairment is impairment. If you see it and you recognize it, then they were impaired. So when you get that test, it's just validating what you saw. Now you can decide what you're going to do disciplinary wise. But pre-employment, it's the opportunity for you to sit down with the guy like we talked before and say, "Hey, under these circumstances, if you test positive for it, you could lose your job. Are you willing to work with us if you know that that's what our policy is?" "Yep, I'm good to go." "Okay." There's nothing that says you can't hire them.
Yeah. This to me sounds like, well, obviously the impairment part of it. This is why the program has to be more holistic. It has to have that impairment piece on it. It has to have that, that involvement. It's not just, you know, you know, here, take this cup into the bathroom. It's a, like I said, more of a holistic approach. I like that. And again, comes back to, taking care of your people, understanding your people, and having a robust program, right? Having a program that works, and
Can't be an afterthought.
yeah, exactly. That the again back to the being proactive as opposed to reactive to some test, right?
Exactly,
I love that.
exactly.
When I dive into the stats, I would speaking about marijuana a lot. When I look at, I live in Missouri, and we passed the recreational a couple years ago, and um, we're already seeing the traffic accidents involving marijuana increase. We're seeing the calls to poison control, especially the edibles, increase substantially. Um, Young people, hospital visits, especially young people get it, like you were mentioning, the edibles. Um, I don't know, some general thoughts on that from you live in a state that's legalized it for a couple decades now.
Yeah, it's a huge concern. You got to figure when I was in law enforcement, before we started getting the hydroponic marijuana and the stuff like that, if you got any marijuana that was like 6 or 7% high THC levels, that was freaking
It's a big
crazy.
deal.
Now our smokable here in Colorado is anywhere from 80 to 90% THC. Okay. Our edibles in tinctures and what they call waxes and shatters, 100% THC, to the point where it's not the drug that you saw Cheech and Chong smoking in the movies. These guys are having audible and visual hallucinations now. A lot of the officers that I talked to that did what I did when I was there, or that do what I did being a DRE, are saying that a lot of times they're calling two drug categories. They're saying, yeah, I'm seeing cannabis use, but I'm also seeing a stimulant. And then they get the drug test back and it says that it's just cannabis because it's a different drug now because we've manipulated it and we've gone ahead and done that. So, look, we've had medical marijuana for over 50 years with Marinol. Okay, the government grows weed down in Louisiana just for Marinol. But guess what we know about that? It's not given to people for pain. It's given to them to stimulate appetites. They give it to people that have cancer, people that have AIDS, things like that, to stimulate that ability to eat or have a desire to eat. So we know that. We've seen that in the movies too, man. Cheech and Chong munching out or people that you know. So we know that part of it. So it makes sense. But the science part of this that President Trump signed into office, well, now maybe depending on how they do the study, we're going to be able to see, does it cause pain relief? Does it do some of the things that people claim it does? Because everything is secondhand. We don't have doctors screaming on top of the rooftops going, hey, my patient recovered and is cancer free now because they smoked weed or they used cannabis. We don't have that. And I would think as long as we've been having it, look, in Colorado, we've had medical marijuana and recreational for over 20 years now. I would think that if we had documented evidence of somebody recovering from cancer or something major and they're contributing it to cannabis, we'd have the test, we'd have the documentation, we'd have all this stuff that should be going to HHS and to the FDA to prove what you're trying to say.
Yeah.
But we don't have any of that. In fact, 3 days ago they came out and they said that they're showing that marijuana does nothing for pain. That was a report that was just given the day before President Trump comes out and signs the thing here for Schedule 3. So
Yeah, I mean,
let's hope that they do it for that part. My part is this. I one, there's too much money involved in this and everybody's trying to cash in. But number two, if you're going to do it for medical purposes, great. But we need to have some protections in place for the community, for your employers, and everybody else so that we don't have to deal with what you were just talking about, these aftermaths and afterthoughts and the results of somebody deciding that they were okay. And so they took this and now we have somebody that's dead or we have something. Look, I've gone to too many homes and had to do death notifications. It's not fun. I don't want employers to have to be doing the same.
I agree. I absolutely agree. Yeah, when I talk to people, I tell them all, especially older folks, I say, "This isn't Bob Marley's weed." I
Yeah.
can't tell you. I You mentioned Cheech and Chong, same thing, right? I can't tell you how many parents, I mean, countless, countless, who will say, "Hey, I don't wanna be hypocritical. I smoked weed when I was in high school." And I'm like, "It's so different.
Mm,
You need to educate yourself. This is not the drugs you smoked 10 years ago, 20 years ago, 30 years ago. This is a much different drug." And like you said, and your friends are seeing as well, mine are as well, it's just acting on the body so differently than it did even 5 years ago, right? I mean, it's just constantly evolving. So
Well, they're mixing it with fentanyl, they're mixing it with methamphetamine, other drugs too. Because if my marijuana that I'm selling you gives you a different reaction than the weed you're used to, you're gonna come back to me to get what I just sold you because you like the feeling of it,
Yeah.
okay? You like the impairment part of it. So we're finding if you look at Quest Diagnostics and you look at their testing data on that, you'll see the percentages of stuff that's coming back, not just from marijuana, but other drugs as well, prescription drugs, other things that are being mixed with it, you know? So we also got psychedelics, man. I look, Colorado, we love our drugs. I'm always going to have a business, man. But we have people now they're ingesting psilocybin mushrooms and they're going into the workplace. These are drugs that will cause you to have audible and visual hallucinations, okay, for life from first time use. They don't know what causes it, but you can have a flashback driving down the highway. It could be good or it could be bad. And that's how it's going to happen. So we have a lot of things that we need to do as a people, a community, and we need to go back to saying, look, we don't want anybody being in pain. We want them to have medical if that's what it's going to be used for. But we can't have you just popping this stuff, getting into a car and driving to work and because you feel obligated that you have to be at your employer or you have to be there. Okay. We have to use some common sense in this. And right now people have none because they think they're safe in doing it.
Yeah, you're right. I mean, there's the medical part, and that's why we have medical and we have recreational, right? But people they bleed them together, and like we talked about earlier, they're willing to even break the rules or bring in the synthetic pee and things like that because they know what they're doing is wrong, but they want to blend those together, even though they are two separate topics. But
Yeah.
we have such a demand for drugs. You mentioned the mushrooms and LSD. I do a lot of work on the dark web with law enforcement, and it's interesting. I'm seeing an increase in the mushrooms and the LSD and the and those types of drugs, and in addition to all the synthetics out there, all the opioids and the new ones. But God, it's scary. We have to reduce the demand in this country.
Well, and we need to understand what is driving that. I've got a study that I'll send you on the psychedelics and stuff like that because there was a lot of failed manipulations that went into that weren't reported. We went to a group of individuals to use as the poster child for this, and that was our veterans, people that are already having PTSD. Okay. So these individuals, if you talk to them, I've been out on calls with this, and I've got friends that have this that will tell you they still have visual and audible hallucinations. Okay. Now we're going to give them a drug that is known for producing that. Okay. They're no longer, Brian, calling it hallucinations. They're calling it experiences because it sounds better, right?
Yeah,
You either have a good experience or you have a bad experience. Well, it's a hallucination either way. Okay. And as you start talking, now there are other things that are kind of like on the crisp that I'm interested in investigating a little bit more, like ayahuasca, where you have people that are going down and it's not addictive, it's not something that you're going to be habit forming, but people are saying, "Hey, I had these experiences and it cured me from my addiction to opiates." I think that needs to be looked at too, because if
sure.
you have a substance that is able to do that, and you can show documentary that this person is no longer having those cravings or they're staying away from it, then I think that's got some validity to it. Okay. Like I said, nobody wants people to be in pain or suffering. Okay. But we got to be careful how we do this because if we're allowing people to still just use this recreationally and abuse it, it's going to cause chaos. And if we don't address this, we're opening Pandora's box and we're going to see a lot of things. Because if not, I guarantee you that you and I are going to have another conversation about the family that lost all this stuff. And now the government's coming together and saying, now we got to change this because people are out of control and people are getting killed. Well, we've been trying to tell you that before you did this, but you
Yeah,
didn't listen. But now it's somebody that you love or somebody that you care about that it happened to. That's what the difference will be.
politicians not listening. Wow. Uh,
Imagine that.
two things, and we'll wrap up. One is how long have you been in business? When did you leave law enforcement to do this full time? How long has it been now?
I I am going into my 15th year as an
Oh,
entrepreneur.
congratulations. That's awesome.
So I got out just before we started seeing all this videotaping and all this other stuff that they do to police officers now,
Yeah.
man. I started seeing that and I told my wife, I said, I did not get into law enforcement for that. And look, I'm human, okay? You're going to get that 30 seconds of me losing my crap with somebody, and that's what they're going to put on 9 News or whatever, showing me losing my stuff, not realizing what happened before
They
that
don't
or
get the
even
entire
after that.
context. Yeah.
I didn't want to put my family through that. Like I said, and I started seeing it going that way. And I got guys that are still in there right now, and they're friends of mine. And I hear from them saying, dude, how do I get out of this? It's a different world. And guys that are doing that, God bless them, man. I don't know how they can do it. A lot of them don't get the support anymore like we used to, where you have administrators that are like going, look, he did his job. This is what he had to do. Sorry for what outcome happened, but it was unavoidable and they did what they were trained to do. We're seeing officers that aren't getting that support anymore. And we have officers, in my opinion, that allow situations to get to a point where it should have been stopped a lot harder, lot quicker, but they're afraid to put hands on somebody. They're afraid to do what they've been asked to do because they're worried about what's going to happen afterwards. And you can't work like that, man. You just can't. It's not effective.
It's not
So
safe. It's not effective. Yeah.
that's what scares me.
No, I agree. I absolutely agree. I have those conversations all the time with law enforcement and seeing that nationally. It's it's interesting, and when you dive deep into it and you start asking these officers what are they concerned about, it's not the defund the police or this and that. It's exactly what you just said. These issues that are coming up, and this is what keeps them up at night, and this is scary, and this has to be addressed. And it's about building that culture, and there are chiefs and sheriffs out there and departments out there that are trying. Unfortunately, I've seen too many that aren't, but that's a whole other conversation. So
Yeah.
I want to. You,
Yeah.
you wrote a book. Can we? I want to,
Yeah.
and I'll put it on the screen here. But it was give us the name and how do we find it?
Yeah. Yeah. The name of the book is Mastering the Impairment Code. It's made for leaders and thought leaders. Even parents can read this book, and it's going to give you the idea of leadership. Okay, I am a certified coach through Jack Canfield. In fact, if you know who Jack Canfield is, he's the person that wrote Chicken Soup for the Soul and the Success Principles. That's a whole nother story with me. But Jack Canfield is the one that came to me and said, "Dude, you need to write this book." And he even wrote the foreword to my book.
Oh,
That's
that's awesome.
how powerful it hit him with this. Saying that I need to get this out there. So that is what I did. So you can find it on Amazon or any of your major players right now with Amazon. If you have Kindle Unlimited, you can get it for free, or if you don't, it's $2.99 for the digital book. Or I reduced the price on the paperback down to 11 because I feel that people need to get this, and I need to do everything I can to get it out to people. The training, like I said, I'm a certified trainer for Jack Canfield for the Success Principles and Coaching. So I do coaching with leaders and things like that. So if you're interested in any of the training, coming out and training you on the book, or just getting some leadership guidance with yourself, I'm more than willing to do that. Just get a hold of me, and we'll go from there.
Is there a website? Can we?
Yeah. You can go to chuckmarting.com, pretty easy. Or even the book has the website called Mastering the Impairment Code, masteringtheimpairmentcode.com. So you can go right there to see where the book's at. You can order it from there. Or you can get a hold of me and see me speaking and some of the things that I've done with training on there. Um, that's where my love and my passion is trying to help people before it's too late. I've had too many employers come in here in tears, thinking they're going to lose everything that they worked for from their kitchen table to where they are now because somebody felt entitled to do these things. And now they've moved on, but now they're having to pick up the pieces and worry about whether or not they're going to have a business tomorrow because of it. And that's what I'm trying to help with. And I appreciate the opportunity to come on here and talk to your listeners and everything else because this is my mission. This is what I feel I've been called to do.
That's awesome. And I love that. I'm going to steal this phrase: leading with empathy and compassion. Uh, teaching people how to be better and how to just care. Chuck, it was a delight. I appreciate your time and the information you shared, and I can't wait to put this out. And I know we're gonna uh, talk a lot more, and look forward to having you at a conference or two, and go from there.
Absolutely. I like I said, I'm honored to be here to be able to talk to your listeners. And if there's anything that I can do to help with any of this, please give me a call. I get calls at 3 o'clock in the morning because of the business that I have right now. I tell people just call me, even if it's 3 o'clock in the morning. Now you might have to give me a few seconds so it doesn't sound like I need a drug test, but I will answer your call. I will get with you as soon as I can because this is important, man. We've got you hear my phone ring and I've been getting calls and emails all day over this because people are they're scared. They don't know what's coming. And so I'm trying to give them that lifeline right now saying, "Okay, it's good that you're aware of this, but let's calm down and understand there's a process that we have to go through. So not everything is lost yet, but you got to act now and we got to be able to address this."
Absolutely. Thanks, Chuck, and thank you for listening to Only 2MG Inside the Crisis.